Hello, my name is Pungdial and I'm from Manipur. I was suffering from a large fibroid along with CKD and TB. And I was under on dialysis under Dr. Manju Agrawal from Artemis Hospital. And then since I'm having a large fibroid, I usually have lots of bleedings, and every menstruation I used to have severe anemia and I used to go for blood transfusion. For this I've consulted many gynecologists, even from Delhi big institution I've consulted, but they refuse to do surgery since I'm having CKD and TB, so many complications can be happen. So they refuse for surgery and they keep on giving me hormones like noresterones and just to stop the bleeding, Trenexa tablet. And then I keep on taking that one for more than 9-10 months, and then like I have done many blood transfusion. There was no successful, like even this month itself, around 4-5 days back, my hemoglobin reached to 2.8, and then it was so severe, but I gave up. I thought like even if I go also, they'll just give me medication and for 1 month it will be okay, and next month I'll get blood transfusion again. I gave up. I thought I wouldn't go anywhere, but my parents, they forced me and they took me to this Artemis Hospital again. And then there, luckily, I happened to meet Dr. Renu. Dr. Renu, she's a gynecologist of this hospital. And then I happened to meet her. She was on her duty on that day. And then as soon as she saw me, she said like, "But beta, aapko to surgery hi karna padega. Nahi to itna, how long are you going to live by this transfusion?"
Patient Pungdial had come to us with heavy bleeding PV to the emergency. And she was a follow-up patient of Dr. Manju Agrawal. She was taking CKD, chronic kidney disease treatment with her, and was on dialysis. And she came to bleeding with emergency, and the bleeding was quite heavy. And she had a history that she had a fibroid in the uterus. And when we checked her, her hemoglobin had dropped down to 2 grams, which was really very low. Also, while taking the history, we came to know that she had recently been diagnosed with disseminated tuberculosis, which was present in her lungs and also in the abdomen, and she had been started on anti-tubercular drugs.
She said she was so confident and then very sweet. And like as soon as I met her, I have the confidence that she can do, yes, she can do something for me. I was so happy. And then I said, "Ma'am, you do anything what you want. I trust you. I have confidence on you," I told her. And then suddenly the next day, she did the surgery.
We knew that she had to be taken up for surgery, but at the same time, we also knew that she was a very high-risk surgical patient. So given her kidney disease, because her creatinine levels at the time of admission was 12, and hemoglobin was 2, and she needed multiple transfusions, and because of her history of COX, she was a high risk for anesthesia as well as a high risk for surgery, because we could encounter adhesions in the abdomen because of the tuberculosis. So we explained to her, we did give her blood transfusions and also did a dialysis to take care of the extra load. But she was also willing after we explained to her for the surgery. So taking all the consents and explaining that she might need to stay in the ICU for a longer time, and there might be difficulty in approaching the abdomen, approaching the tumor, and we might need a GI surgeon also to help us, she decided to go ahead with the surgery. So we did take her the next day. We took her up for the surgery. We gave her 3 units of blood transfusion and then dialyzed her, and after that we took her up for surgery. She was also worried that because she had a big fibroid, she may land up with a hysterectomy, which fortunately she didn't land up with. We took out her big fibroid, we did the surgery, went off well, and post-operatively also we had to give her a dialysis. She is still on regular dialysis, but she has done really well. Post-op hemoglobin has risen up to 8 grams, and she is ready for discharge now after this, though she will have to follow up for the dialysis with Dr. Manju Agarwal in nephrology, but I think she's at least been taken care of as far as the bleeding which was leading to severe anemia is concerned.
I'm feeling so happy, like there won't be blood transfusion again. I can go out with my friends, I can be happy, I can go anywhere now.